the next topic is Cyclospora. This is very similar to Cryptosporidium. So we will just take note of the similarities and differences. Okay? Unlike cryptosporidiosis, this is common in both tropical and subtropical countries. As you can see here, I'll try to highlight this one. Produce, meaning fruits and vegetables, are actually the sources of infection rather than just water sources. It is caused by Cyclospora cayatenensis. Again, it is a coccidian, meaning its cysts are circular in nature. Similar to cryptosporidiosis, you ingest sporulated oocysts. That's the infective stage. And similarly, it goes into your intestines where they become sporozoites and invade your epithelial cells. They would undergo both asexual and sexual reproduction. We've discussed this earlier. However, the difference is that they produce unsporulated oocysts. So what's the significance of unsporulated oocysts? It is not yet infective. So what happens if it's not yet infective? It needs to sporulate outside of the body. Okay, using particularly favorable conditions like temperature, humidity, and all that. So as you can see, the life cycle is very much similar to your cryptosporidiosis. They're circular in nature. Ingestion, development, exit. And you also have your sexual and asexual reproduction happening inside your intestine. Symptoms are very much similar. Diarrhea, a watery diarrhea, is usually the manifestation. However, this is seen in both immunocompetent and immunocompromised people. Diagnosis, very similar to your cryptosporidiosis. Microscopy is still used using fluorescent dyes or differential interference contrast microscopy or DIC. Concentration techniques can also be used. FECT, don't mind that. Cyclospora, together with your cryptosporidium and your isospora or cystoisospora, are actually acid-fast, meaning they stain red using your acid-fast stain or your safranin stain. So that is a reddish acid-fast cyclospora cyst. This is a safranin stain, staining red as well. And these are ghosts, wherein these are empty cysts. These are dead cysts already, probably due to treatment. How do you treat cyclospora? Cotrimoxazole or trimethoprim sulfamethoxazole. Now please study the mechanism of action in more detail. So prevention and control, very similar to cryptosporidiosis. Hygiene and sanitation, washing of hands, washing and cooking of food, drinking safe water, sanitation, and education. They also want to employ wiping of washed produce properly because cysts tend to stick onto the skin of your fruits and vegetables. You have to wipe them after washing them. And canning and freezing will also kill the cyst of Cyclospora.